We're going to have an update on the mobile health unit by Bernie Revak from Valley Care. Tom Vargas will introduce it.
Hi, everyone. I guess probably it's not a surprise, but the Livermore Rotary Club has had a long relationship actually with Valley Care Hospital and serving in various ways. Tim Weaver, David Murtis, myself currently have been active with the board of directors for Valley Care. Bill Nebo was a former director at one time. The project that was mentioned about Kosovo, Jessica Jordan, who's here as a guest, worked with David on that project. So there's just this long relationship. And of course, when Bill Geyer was president of our club, he also served on Valley Care's foundation. And one of the projects he was really passionate about was the mobile health unit that we ultimately were able to purchase through the foundation. So when Bill, our good friend and Rotarian, passed away this year, it really inspired a few of us to kind of get together and see how we might kind of reinvigorate our attention on the whole mobile health unit and the ongoing operation of it so that it would be a lasting legacy in the community. And part of that process involved meeting with Bernie Revak to help identify some of the issues early on. And so Matt Ruska from the Morning Club, Gibb Souza, Stu Gary, and myself had really met on an ad hoc basis to kind of just delve into some of these things. One of the things that happened was about $3,200 was raised in Bill's memory. And so we helped work on a program that dispersed the funds around that donation. And we wanted to come up with a program to strengthen the overall mission of the MHU in partnership with Valley Care, whether it be operations, community support, or financial support. And so a couple of the immediate successes that have come out of that so far is that the money that was raised in Bill's memory helped to go towards purchasing tires for the unit. And so just recently we did that. And just recently, in the last couple of weeks, the city of Livermore has signed a maintenance agreement with the hospital regarding the ongoing maintenance and service of the unit. And so in the past, it used to have to travel to various places in Oakland for generator service and one thing or another. It's now going to be handled by the very skilled and competent people here at our maintenance center in Livermore. So the goal is to... So our goal was to just to make sure this MHU continues to serve the community into the future and meet its needs. And so Bernie Revak, who's the director of our infection control and outpatient services for Valley Care Health System, is going to tell us a little bit about that. Just background for Bernie, she has a master's in nursing. She's a licensed public health nurse. She's on the board certified in infection control. She's active in a number of professional associations and serves on the University of Phoenix nursing staff, education staff. She has over 30 years experience. She must have started when she was really young. And she's worked in all areas of the hospital over her career. And she currently provides clinical direction and oversight for outpatient clinics, which includes the mobile health unit, student health care center at Chabot College, both in Livermore and at Las Positas, and in Chabot. And then also we have a relatively new clinic that's opened at Walmart, and that falls under her jurisdiction also. So Bernie helped design the mobile health unit and in 2006 and 2007. Without further ado, I'm going to introduce Bernie to tell us more about it and the operations and kind of where we are today.
Good afternoon, everyone. Let's see, do we go up or to the side?
Do the right-hand arrow.
Awesome.
There you go.
So I'm sure you've all seen the unit. You've seen pictures of it. It lives on its off days behind Valley Memorial Hospital in the back. where it's plugged into a power source. This is a summary of the program since inception. It started its service in August of 2007. That's when we became licensed. And these are the statistics through December 31st. We've served a total of 7,882 patients, and that is anything from pediatric, sick visits, physicals, referrals, and immunizations. We also have an immunization registry which connects to the county, and it connects with most of the physicians here in the valley. And so these children that come and get immunized by us, their records are like hardwired in, and somebody can access them from anywhere. Just like when they had Hurricane Katrina and the kids relocated here, they had those records available. We do serve more adults. They seem to be a more needy population. They come in for blood pressure checks. We've provided health education at community events as well as going to schools. We've done health screenings, which include blood pressure screenings, vision, and blood glucose screenings. We do hearing screenings. We have done hearing screenings for some of the schools as well. So for 2013, we did see 910 patients this past year. We did incur some operational issues where the unit was down, had to have repairs. But just since May of this year, or past year, pardon, we saw 536 patients. And this was an event that we did. We did an outreach to some homeless families. We came in, we did immunizations, flu screenings, and just wellness checks. So just to give you an overview, the financial investment, the Rotary graciously gave us the unit in 2007, and the cost of the unit at that time was $313,402. And we have been operating it for the last 7 years, and we're entering our 7th year rather. And our investment and commitment to the community in providing staffing, oversight, and supplies is $937,000. Last year, it cost approximately $211,000 to operate the program for the year. And I have it broken down there for the nurses, the medical assistant, and the physician professional fees and oversight, and that the non-wage expenses would be like the licensing, supplies, CLIA, any of the license we need, permits through California Department of Public Health, and then the federal licenses as well. We do receive about $30,000 to $40,000 a year in grant funding and donations, so that offsets our expenses. So we do run the vaccine program through, like I said, that electronic registry, and this just gives you an idea of what the grouping, the ethnicity of the population that we're seeing. We're seeing 6% Asian, Middle Eastern 6%, Hispanic 60%, Caucasian 20%, African American was 6%. And that is actually all data that goes to the California State as well as the CDC, because they're the ones who fund this program. It's funded, they give us the vaccines, and then we provide them and provide the care and screening. So we did a community needs assessment looking at Alameda County, what the high risk for Livermore, and what they look at as trigger points. And coronary heart disease, we were the second highest rate in the county. Cancer, we were the second highest rate in the county, and that's in their published report on Alameda County's public health site. We also had the highest suicide rate in Alameda County, here in Livermore. So this is just a snapshot of one of their tables showing how it breaks down. Chronic lower respiratory diseases. You know, everybody thinks we're out here in the valley, our kids, we do have a lot of asthma. It is a problem as far as education and reaching out to the students to make sure that they are being treated effectively and their treatment is maintained. But we actually have the lowest ER visits in the whole county, which is really good. So we're doing something right. We're reaching out there. The mobile health unit does have a nebulizer on the unit. So, you know, kids come in or they need some assistance or training with their little inhalers. We have those supplies and the ability to help guide them through that. So we have a large focus on screening because, as you saw, what our high-risk populations were. So we are looking at the hypertension, obesity, and the high blood glucose in pre-diabetic and diabetic patients. As well as we're trying to establish primary care service and information, and we do that in a bilingual manner. Our medical assistant is bilingual. She speaks Spanish, and our past nurse practitioner, she actually spoke Mandarin and Cantonese, but we have a new nurse practitioner now. So, and we do have the ability to do translation on the unit. So Valley Care, we were asked about our health needs assessment, and that is actually on our main website. So if you go to the main website for valleycare.com, you will see that there's a tab that says About Us. And if you go to Community Benefits, it shows what we participated in on a county-wide, and then there's an implementation plan. So we identified the issues in our area and in Alameda County, and then we developed an implementation plan. And so that is all there for your review. I was going to bring some to hand out, but they're like little books. So I thought you could go, if you're interested, and read it there. If anybody would like a hard copy, just let me know. So Tricia Gonsman is our lead nurse practitioner. This is Angelina Chow. She just recently left us, and they're just great. They're very committed nurse practitioners. And this is just a snapshot of one of the blood pressure screenings that we did. So our outreach activities just for last year, we've been trying to reconnect with the schools. So we're starting to attend talks at Rincon Library, just to let people know what we do, what our role in the community is. We are not there to be their everyday primary care provider. We are there to help them with their, urgent or medical needs at that time, but then to find them a medical home, either through access or through a primary care provider through Valley Care. We are speaking to the first 5 preschool groups. We are trying, like I said, to work with the school districts. We're exploring potential screening and evaluation clinics, trying to get a theme going. In the spring, there's been some requests to do some asthma outreach, sun safety clinics, and diabetes clinics, mental health days. Since that is, a concern in the area and it is a need, we're looking at the possibility of developing some mental health evaluation services. And then marketing and messaging, we're kind of limited. We do have our brochures that we hand out. They go to the schools. They're put in all the ERs, urgent cares. We try and get the message out. We're working on that. It is a challenge. We're trying to create culturally compelling messages to try and get people to come to us so they don't feel threatened to. And we did just order a sandwich sign just to try and get people to get a draw in, instead of the handmade ones that we had some preschool kids work on them. Yeah, that was some of the blood pressure. They had a ball doing that. So. The senior centers, we have been going to the senior centers and doing screenings. We plan half days there, and that's been really successful. And they really appreciate our services there, doing the reach out. And that's just a sampling of who we've been to. And we have 4 events scheduled just for this month, and they're starting this week. Okay, what am I doing? I hit the wrong thing. Okay, so senior center group homes, you know, and continue to offer those screening services. I went the wrong way, sorry. Am I going the wrong way? Ah, there we go. Sorry about that. Okay, so we did kind of a strength, weakness, opportunity, and threats analysis, and it just kind of summarized where we are and where we would like to go and what some of those barriers are. You know, our strengths are we have committed nurse practitioners. We give exceptional care. Our nurse practitioners are all certified, which a lot of other NPs out there, they're not required to be. That's part of our Valley Care commitment to patient quality care. High patient satisfaction. People that do go to the mobile health unit, a lot of them will come back and, you know, or they are put into a permanent provider. We have very good organizational support, and we have it tied into our disaster plan. The mobile health unit can respond to any disasters in the Alameda County. When we first started it up, they wanted us, there was mention that we were going to go down to San Diego to the fires, and it was like my nurse practitioner's eyes got as big as saucers thinking they're driving the thing down. Some of the weaknesses are, you know, the cost. It is an expensive program to run. Messaging, as I stated, we need to improve that. We have to increase, you know, use by high-risk patients. We have had drug seekers and some violent individuals visit us. Maintaining the unit as it ages. We've encountered some service issues just in the last 6 months. And, you know, that happens with anything as it gets older. Staffing for local events. You know, again, if you look down to the threats, you know, we have issues of complaints of diesel fumes, and so we're looking to have power stations. So we don't have that complaint of people having potential irritation from diesel fumes. So we're trying to seek stronger partnerships, you know, with the Rotary and other organizations, and increasing the visibility in the Tri-Valley. You know, it's a great partnership that we just entered into with the city of Livermore for the maintenance. You know, we're keeping our business at home. That's great. Better messaging, focus group surveys. So we're going to start actually polling people who are coming to the unit. What can we do better? You know? Electrical power stations, like I mentioned. Ambassadors, having people go out, and that's part of their goal when they're going to these talks at the libraries. You know, getting the message out. Seeking grants. Grants are kind of tough right now. They like to look at new programs. So they'll give you funding for the first 3 years. We did get a grant in that first 3 years, but it's pretty limited for ongoing. Other discipline consultants, you know, we're looking at, you know, getting a social worker, having a pharmacist maybe be on the unit one day, advertising that, you know, they can help with some medication reconciliation, because that is a big concern for people these days. Dietitian, we're all, you know, with the population and the obesity rates, you know, that's a good thing in the kids and the pre-diabetes, just counseling in general. Respiratory therapy, again, touching on the asthma, the emphysema, and then the mental health. So safety of the staff is a concern. We had an event at one of our current sites that we had to call the police. And it was kind of scary, you know, they were not friendly people. So our future usage, which will require additional funding, you know, we're trying to increase the visibility in the community by installing those electrical shore units. We have one in Pleasanton and one in Livermore at the VMH site. But, you know, we're going to be seeking some partners to help us get one maybe in downtown Livermore. We have multiple requests to go to the rodeo grounds. You know, you combine the dust and the smell of the rodeo along with the diesel fuel, it's not a welcomed, plus it's a little uneven out there, So, you know, we want to put this unit in some key locations and have it serve people and not then perceive it as being harmful. Expand our community outreach activities past 2 days a week. Even doing 3 days a week will give people opportunity to come in and get a TB screening. Because when you do a TB test, you have to come back 48 hours later. So right now, if they don't make it on Wednesday, they have to come back the following Wednesday because it has to be read on Friday. And expand services to include mental health services. And we just wanted to thank Bill and thank him for the tires and thank you, Diane. He and I, we designed this thing. So we'd just like to thank you on behalf of Valley Care Board of Directors, administration, and the members, and most importantly, the Tri-Valley residents. So. Yeah.